Ah. Hi, good morning, everyone, and welcome to MyDiabetesHQ Live. Just give me 1 second, I apologize. My name is Joy Ashby Cornthwaite, and I'll be your host today. This weekly broadcast is developed and produced by Cities Changing Diabetes volunteers from Houston and our sister city, Philadelphia, which recently joined the global network of 25 cities working to improve diabetes prevention, care, and management. If you'd like to learn more, please go to citieschangingdiabetes.org. The purpose of this effort is to help people with diabetes and their caregivers successfully transition through these very challenging times, including COVID-19. Each Saturday, we gather diabetes care experts to discuss and to share their incredible knowledge. They have years of self-care, medical care, public health, community health, and advocacy, and will bring this knowledge straight to your waiting eyes and ears. Today's episode is coming right up. You don't want to miss this. Remember that the information that you receive today does not take place of the expert opinions and planning by your physicians. So today, this morning, hello to our viewers, champions and warriors. Today, this is our 7th episode. Today, we are going to have a discussion about a very important topic, health literacy. It threads together all of the aspects of diabetes care, from the way appointments are made to getting there, to learning about your diabetes, and especially to opening good communication between yourself and the clinical care team dedicated to helping you live your best life. Today's format will be the same as usual. So we will have a presentation of health literacy and then answer the question, what in the world is health literacy and what does it have to do with my diabetes? We are joined by Susan Cosgrove, Director of Health Literacy at the Healthcare Improvement Foundation in Philadelphia. Hello, Susan.
Hello, good morning.
Good morning. And we also have joining us today from St. Louis, we have Catina. Hi, Catina O'Leary. She's President and CEO of Health Literacy Media, and she is also a social worker.
Good morning. Thanks for having me.
Good morning. We also have Serena and Marianne, our Houston-based team. Hi, Serena. Hi, Marianne.
Good morning.
Serena is our CEO of Core Initiatives, a Houston nonprofit for health and wellness, and she's also the program coordinator for our Cities Changing Diabetes Initiatives peer support group. Mary Ann is working on the front lines of the COVID pandemic. She is an RN and a certified diabetes specialist. In her free time, the free time that she has, she works with the disaster response coalition to improve diabetes care planning around and during disasters. Today, just as a forewarning for our viewers, we are in the midst of receiving the outer bands of a hurricane here in Houston. So if we fall off, we will be right back as soon as we possibly can. Those are the intricacies or the difficultness of live broadcast. Mm-hmm. So Susan and Catina, let's get into it. And of course, my local team, thank you for spending the Saturday with us. I think I've said health literacy a lot of times today without explaining it. And so that goes against the very concept of health literacy. So before I continue, if you both can save me and introduce our viewers to the concept of health literacy, as well as what you do along with your colleagues at your institutions to improve care for individuals living with diabetes and any chronic disease?
Great. So I can start with a simple definition of health literacy. So health literacy is the ability to find, understand, evaluate, communicate, and use information to make informed decisions about your health. It encompasses a lot of different things, but pretty much includes everything you need to know, understand, and do to take care of yourself and stay healthy. My organization, the Healthcare Improvement Foundation, a lot of our health literacy initiatives focus on both providers, so educating and training providers, as well as helping to empower patients, because health literacy really goes both ways. You need both patients and providers involved to make sure that everyone understands each other.
Super. That's a pretty clear understanding. Catina, do you want to add anything to that?
I certainly couldn't have said it any better. Susan did a great job of describing health literacy and giving us a definition that's workable. And the really nice thing about that definition is it gets at the totality of the issue. This is a big tool that we can use in health literacy, and we can use materials, we can use communication, we can use videos, we can use all kinds of strategies and tools to make it work better for people out in the communities. But it's all about that two-way communication between people and systems and providers to make sure that communication is clear and people can access and use the information they need to make the best choices for their own lives.
Excellent. So how do we put that into practice? How, for a viewer looking right now and thinking, this sounds really great, this seems like something that I've been after for my care, how do I communicate this? How do I practice this? And why? Why should I?
Sure. So the first thing that I want to emphasize about health literacy is that it's something that impacts most people. So up to 9 out of 10, so almost everybody will need help understanding health information at some point. And not understanding your care or having trouble understanding health information is a really, really common experience. And I think most people have had that experience. I've had that experience. I'm sure everyone here has had that experience. And just want to emphasize that it's not something that you need to be ashamed of. And we'll get into today really some of the things that you can do to help improve your health literacy and to really help you feel comfortable advocating for yourself in those moments where you feel like you're not connecting or you're not communicating well with your provider.
And just to add on to Susan's comments, I think it's really important to understand that it does happen to everybody, but not always all the time. We talk about health literacy as a dynamic concept. It happens sometimes in certain situations, whereas at other times when you feel really great, you might be very capable and very comfortable, and it might be very easy to communicate. But when you feel very sick, when you have a new health condition, when you have a fever, when you're just stressed, your health literacy might be more challenged and it might be harder for you to communicate. We think about it as a state, not a trait. So it's not who you are, it's how you function in an environment in a certain time. So if you have a bad experience once, that doesn't mean that you're always going to have a bad experience or you're always going to feel nervous or scared. It means that this is something that can get better. This is something you can practice. There are tools you can use and also tools your provider can use to make it better for you.
Mm-hmm. And I think there are specific circumstances happening now also that can make it really challenging. Like with COVID, a lot of appointments are now happening virtually. So instead of going to see your provider as you're used to doing or as you normally would, you might have to navigate an app or log into your patient portal or have a phone call or a video visit, which is something that can be really new and can feel really different. And that technology barrier can make it harder to connect with your provider, even if it's someone that you've seen before and have a good relationship with.
Mm-hmm.
I just had this with my mother. She has a health condition, and she was saying, gosh, they want me to do a visit or see them in November. And I feel like I can't wait until November, but I'm not sure that they can do what I need them to do on televisit. And so the anxiety and the stress of what's the right thing and how to make this work, particularly now when you don't necessarily know it's safe, is a real challenge for folks.
Mm-hmm. And so can we maybe take and break that apart a little bit, Catina, like what you and Susan are saying right now? So, okay, so now we have this situation of I have a telehealth visit, but I really I feel like I need to be there. How can, before, if someone accepts a telehealth visit and they're feeling anxious about it, what are some steps that are sort of imbued or like some of the feelings of improving health literacy? What are some steps just for people right now who a lot of people are getting telehealth visits right now? They may not want them. How do they figure it out before they get to that telehealth visit?
I think one thing that's really important to keep in mind is that a telehealth visit is often a first step, and it's a way for them to make a decision about whether you need to come in and maybe take a risk to go in person to either the urgent care or the emergency room or your doctor's office. And so this is a place where trusting the provider with the technology is useful. They can, in my mom's case, for example, she has a dermatology issue, and so she's afraid they won't be able to see it and that the telehealth visit won't work. And so what I keep trying to tell her is, you can try it, and if they don't see it, they'll tell you to come in and they'll tell you about the next step. But this is the first step to getting the most efficient care that you can get, and you can get someone to help you with the technology. So the things that she's worried about are, how do I get on, and what do I do, and how do they see it? I'm trying to explain that, we'll turn on your iPhone like a FaceTime. You guys have all done that during COVID because that's the only way you can connect with the outside world. So we're going to do the same thing with your doctor. We're going to turn on the lights so that the doctors can see whatever it is that you're trying to show. We're going to make sure that we're dressed appropriately so that we can, move clothes around or do whatever we need to do for them to see the right places on your body. We're going to make sure we're in a quiet place. We're going to make sure we're calm. And then we're going to be prepared. We're going to show up on time and be as patient as we can as they work through, and they help us because the doctors on the other side have done lots of telehealth visits. We're not the first people who've been nervous or stressed or didn't know how to do it. So the staff on the other side can walk us through that, and they're very comfortable doing that. So we can trust them to help us. And if they say, geez, we can't see that, or that's not going to work, or we don't have enough information, then they'll tell us what the next step is. But we have to sort of be together and be partners in this. And it really is also okay if we let them know we're stressed out and we don't know how to do it, so they can walk us through from their experience what other people have done when they've been stressed out. But like any other visit, if you can have a partner there with you to help you navigate the technology and keep track of information, that's always good health literacy advice.
And I think you can try to practice using the technology ahead of time too. So if they're using Zoom, if they're using Blue Jeans, whatever platform they're using, you can always make sure that you have that installed on your phone or your tablet or your laptop or whatever device you're going to use ahead of time. You can do that a day ahead of time. You can do that 15 minutes ahead of time. So that gives you the opportunity to troubleshoot anything that you need to do on your end to remedy the tech. And just want to also say there are some things about telehealth visits that are actually like more convenient or can be more accessible. Like, for example, you don't have to worry about leaving 45 minutes early to navigate to the office and get there. Like, you really just have to find a place in your house where you can sit down for your 15-minute or 30-minute visit. So I think it's also worth, stopping to think about the ways in which telehealth can be beneficial to you and more convenient, and to try to balance that against sort of the stress of trying something new.
I liked your point about having somebody there with you while you're doing the telehealth visit. I know we're using even some of this in the hospital setting, and usually the nurse is in the room along with the patient. Sometimes the doctors are outside of the room, and but having that nurse in there being able to help with all of the things that you just mentioned is really a good idea.
Serena, when individuals come to you and ask you about telehealth, I know that it had been something that I think your group members had said something about. Do you want to expand upon like the concerns, kind of like Catina was saying with her mom?
Yeah, sure. So with telehealth, like Catina already mentioned, it's a little anxiety that comes along with not being able to go to see the doctor in person because you're not sure it's really going to help because they can't actually see you. So that is really the major concern with that. Not only that, it seems like in person is a little more personal than telehealth. even though we can see each other and we might vibe because we're used to seeing each other now through, technology, a lot of people are just not feeling it. That's the best way I can describe it. They're just not feeling it. But it's important that they do so, so that they can get their concerns addressed.
What do you say to someone, Catina, when they're saying that the technology is hindering the personal connection?
So it's interesting. There's some data that recently came out that said exactly what Susan said, that for a lot of people, they prefer these telehealth visits for the convenience and the efficiency and all of those factors. And so particularly for people who are younger, and when I mean younger, I mean maybe people who have young children, people who have middle school age children, and all the way down. The idea of adding one more thing, like getting in the car and driving 45 minutes and waiting and all those things, is a real challenge. People who live in rural communities. So telehealth really brings them an opportunity that they've not had before. So they're pretty excited and they're pretty comfortable. And then the people who are the most stressed about it really, according to the data, seem to be older adults who have really enjoyed the social part of visits. So getting out to see a doctor maybe was an activity. Maybe someone came and took you to the doctor visit. Maybe you typically would go have lunch or stop at Target or have some kind of activity. And so that's the actual piece that they're missing as well, not just the uncertainty of the doctor visit. And so that's the other thing we talk about, is if you can have someone with you to help you with the tech issues, practice like Susan said in advance and sort of alleviate those anxieties. And then think about what you're really upset about. Are you sad to miss your adult child coming to pick you up and transport you and spend time with you? And if that's the case, you can replace that in another way, right? Like it's not really about the doctor visit necessarily. And then as for the other concerns about, they might not be able to see my same condition, or, they might not be able to do the medical part. I think that the request is just to give it a try. I mean, this is the social worker more than the health literacy professional. Let's try it once and see what happens. If it really doesn't work, it's not like it's your last doctor visit ever. You can go back, we can go to the ER, we can go to urgent care, we can go to your primary care. There are all these things that can happen. But today, this is the appointment you have. It's pretty easy. All we have to do is get on your phone. So let's just give it a go. And if you hate it, we'll figure out another alternative.
Yeah.
Yeah, and if I could just add to that too, as I mentioned at the top, health literacy is really about both patients and providers and that relationship. And as much as providers have been kind of doing these telehealth visits now over the past several months out of necessity, it's kind of a world that they were also very much thrust into. And I think there was some anxiety and discomfort there on the provider side as well. And I think sometimes just acknowledging that that's a shared feeling can be really powerful, and kind of understanding that, maybe you're feeling a little awkward about it, even though your provider has experience with this and has been doing it, maybe it's not necessarily how they would prefer to see you either, but, you're both in this together to really make the best of the situation and get the most out of the visit that you have.
One of the things that I've noticed, because, of course, in the hospital, I was always going into the patient's rooms, but, now I'm calling them on the telephone. And like I said earlier, usually, I can get the nurse to go in there when I am making that call, which gives them a little bit, more confidence. But during that first initial few minutes, when I'm explaining to them that I'm going to educate them by phone, they're a little hesitant. But then later on, when I do another follow-up call later, it works really good. So I think they've learned that it was working out, and they get a little bit more confidence that second time around.
Mm-hmm.
That's a great health literacy sort of point, though. All of us are uncomfortable when we're doing anything for the first time. So that practice, that skill, we sort of build an expertise and we start to feel really good about it. And then we become the person that can say to our friends, hey, I did a telehealth visit and it was okay. Dr. So-and-so is really great at this. If you have questions, talk to nurse so-and-so. And that sort of builds up that confidence. And once you're able to build a confidence area in one area of healthcare, it extends to others. So I think this is a great place for people to practice their health literacy and communication skills. I think it's a great opportunity.
Yes.
Excellent. And if there are any viewers out there who this strikes a chord in, go ahead and send us your question or a situation that you'd like to share that we can kind of discuss here live with you today. So this, now that we know sort of an example of when health literacy comes into play, are there specific ways and tools that we can use to grow and to learn a little bit more about putting these into play, like things that we can, different skills that we can practice before we head into situations?
So, one of the things that we really work hard on the patient side to practice or to help people practice is to really think about what your issues are before you attend the visit. So if you can make a list of the things that are important to you, the real questions you have, that prepares you to be able to have the conversation. Whether it's in person or telehealth, we all know that we're very time limited in the actual room face to face with the provider. So being prepared, having your questions listed out, being ready to know what you want to know rather than responsive when someone says, "What questions do you have?" with their hand on the door, I think is the most important thing people can do. And then also just being an advocate for yourself. So if you're in a situation where perhaps English is not your first language, or you have lots of interruptions, you have children with you, any of those things, thinking about how do you advocate to make sure that you have what you need in the visit so that you can give it your full attention, I think is a real individual health literacy skill. And not apologizing for that, right? Like, it's your visit, it's your 15 or 30 minutes, it's your time. And so you don't have to feel bad for asking people for an interpreter. You don't have to feel bad for asking people to slow down. You don't have to feel bad for, asking the nurse to explain again. You don't have to feel bad for asking for somebody to write it down for you so you can take it away. You don't even have to feel bad for asking if you can record it, right? There's no reason that you can't record the message so you can listen again with your friends and family. And you don't need to apologize as a patient for any of those things. Those are all the things that you need to get the most out of your visit. And if you find yourself in a situation where a provider makes you feel uncomfortable, then perhaps you can go back and start to think with your friends and family if this is the right relationship for you. If you can't ask the questions you need, it's also okay to find another doctor. And I don't mean that to say that doctors are bad, but sometimes the fit or the connection between a provider and a patient just isn't great. And if it's not working for you and you don't feel comfortable asking the questions, you don't feel like you see people like you don't feel like it's the place for you, there are lots of other places in the world.
Those are all really, really great points, Catina. And just sort of a story on that note, one of the groups that my organization works with is seniors. We work with seniors to train peer educators to help them, train their peers, neighbors, friends, and family on how to self-advocate, in these situations. And, recently during a peer educator training, we have a senior that we've been working with for a while, and they just said, well, now if my doctor doesn't listen to me, I just fire my doctor. I just get a new doctor. And, I agree. This is not to say that that's always the right path. There is always an option. But, I think that when you learn to advocate for yourself and you learn to become really comfortable in that way of being, especially in healthcare encounters, I think it does open up the possibilities for you, and you can start to think critically and think about if your providers are meeting your needs or if you need to maybe go in a different direction. So
one of those things that I've noticed too, Susan, is that it seems like, especially with that second time that I make that call to the patient, and they feel a little bit more empowered, and then they come forward and they tell me some more details about if they're having any barriers to their care. So I don't know if it's because we're by telephone that they feel a little bit less intimidated to, tell me more, but that's almost what I'm seeing. I don't know if that's something research is supporting.
Are you saying a secondary experience with that, with a new something?
Yeah, they feel a little bit, I think, because of the distance. I'm not in the room, I'm on the phone. And sometimes I think when I'm in the room, they might feel a little bit intimidated telling me more about what's really going on and what their barriers are. I think they feel a little less intimidated because we're on the phone. That's what I'm seeming to notice.
Yeah, I agree. Even when it comes to social media, when we have peer support online, um, even having the in-person meetings, people might just sit, you ask a question and they may not say anything. But on Facebook, they may type a whole story. And you're like, wow, you're talking now. This is great.
Yes.
So yeah, sometimes in person, it depends on the person and personality trait, but sometimes the person is less intimidated if they're not in your face. Yeah.
And I think, like we talked about at the beginning, like all of this is about relationship building, right? It's about building the trust between patients and providers. And all of these health literacy techniques, they're about taking care of yourself and knowing what you need to do to stay healthy, but they're also about making sure you have that good communication and that good relationship with your provider. And just want to emphasize, like, health literacy is not something that like you're doing at each other. Like, your provider's not doing health literacy at you, you're not doing this at them. Like, it's really about that relationship and working together.
So, what about language? What about the words or the sort of the emphasis behind certain words? What about those things that are bridges really to communication? How does someone, it's a very different situation when, maybe you feel defensive when you go in to a visit, and you think, automatically, and this is something that's very real for people living with diabetes, I'm going to be judged on the basis of my glucose values, right? That is just an overarching consideration that I think people walk right into an appointment with me and they're like, they feel defeated already, right? Before they even get there. What are some things in self-talk, maybe, and self-preparation, practicing with someone around you? What are some things that you would suggest to someone who just feels that burden of ownership of this disease all alone, even going into an appointment? What kind of words can they use to convey that?
Well, I think, again, first of all, that's such a common feeling, and just want to acknowledge that it is really hard. It's hard to take steps to feel empowered when you're feeling very disempowered, or when you left your last visit feeling like you're not making progress. So, want to acknowledge that. And it doesn't feel good to feel that way. I think, one thing that I would say is to celebrate all of the wins, like celebrate every step that you take in the right direction, celebrate everything that you do on a daily basis to care for yourself. If you are taking your blood sugar levels twice a day as directed by your doctor, that in and of itself is an achievement. Any changes that you make, and try to think back to that, or like think about a couple accomplishments or a couple ways in which you take care of yourself that make you feel really good and make you feel really proud of what you're doing, that you can kind of think back to and hold on to in those moments where you feel like things are not going as well.
Agreed.
I think I also think even I'll speak for myself. I am a person with diabetes, and I am a diabetes patient as well. So I'm the type of patient that if you tell me to make a log of checking my blood sugar 4 times a day, right before meals, 2 hours after meals, and I write all of that down for you and I bring it to you, and I'm feeling all good when I walk in and I'm like, oh, I did everything. And then it's not even looked at. It's not even paid attention to. Like, doc, here's my log. And it's like, okay, good job. But he didn't look at it. I tell people all the time, you've got to, all that encouragement has to come from within to begin with, because everybody might not be as excited as you are about your journey, but you have to take into consideration that even if you are the only one, you have to be proud of everything that you've done. Just like Susan said, all the small victories are just as important as the big ones.
Yeah.
And I don't know, Joy, if you've gotten this from teaching patients before, but I'll tell them about how to check their blood sugars and, to write it down and all of those practical things. And then I've had patients say to me, why? And so I think that's an important question that, people with diabetes can ask their providers, like, why are you asking me to do this? And I would like to hear other people's thoughts on that.
Definitely. Why is always a good thing to start off with, because it's just like when you're raising kids. You tell your kids, don't do that, don't do that, don't go over there, don't do this, don't do that, and they may still do it. And you're like, why did you do that? And it's like, well, it isn't like it must not be a good reason why I can't, because you didn't explain to me why.
Yeah.
So it's like, oh well, I'll just do it anyway, and I'll find out why myself. Why is always good to start off with.
Yeah. So this goes back, I think, to the when Susan and Catina are telling us, it's not a one-way street, it has to be a two-way street. So if you know that it's a time to interject or to say to your doctor, but why? What does my number actually mean? Then on the flip side of that, your clinician or your doctor should be saying, well, this is why. And so I think next week when we continue this conversation into from the clinician provider side, how you should receive that, I think we'll come together and see the synergy or the way that these two pieces fit together, right? So there's you practicing and using your skill to improve your care. And then there has to be a meeting of the minds, So when you take your appointments, when you're going into your appointment, these are 3 questions that you can ask, right? We've said it before in the broadcast. What is my main problem? You can write that down, practice it with someone, with your support before you go into the appointment. I'm just sort of like role play. What do I need to do? What is being asked of you? What will you need to bring back to your appointment? Will you need to fast for your labs on the next appointment? Where do you need to go for your next appointment? How do you, whatever it is that there needs to be a couple of things that you can do that are tangible. And then why is it important for you to do these things? Susan, do you have anything else to add to that?
Yeah, so I guess I would just come back to, your original question about language. And, we encourage patients to ask those 3 questions as a starting point. You can ask more questions than that. But one of the really foundational, one of the basic things that we tell providers to do is to always use plain language, to just speak in a conversational manner, to speak to patients as if you are having a conversation with someone in your living room, or as if you're talking to a friend or a family member, someone who's not a medical professional. And I think from the patient perspective, anytime you hear a word that you are not familiar with or a concept that you've never heard before, something that's really complicated, it's always okay to interrupt and ask what that means, and ask for it to be explained to you in a way that you can understand in plain language.
Mm-hmm. So someone's asking, Andrea from San Antonio is asking, are there any resources on the internet where she can learn more about health literacy? And we have the answer. So the American Diabetes Association has a list of common terms for medical words, and you're able to go there and see, sometimes someone might say hemoglobin A1C, and you're thinking, what is that? It is the measurement of your blood of your blood glucose levels or blood sugar levels over the past 3 months. It gives you some really easy definitions, and those are useful for patients and for a clinician. The power of the words we choose. From the Association of Diabetes Care and Education Specialists, we want to create language that is supportive on both sides. And then also we will have, we will be showing a video really soon of health literacy needs right here. And health literacy beyond the words, navigating healthcare. There are videos on Vimeo that health literacy media has created. They're about 2 to 3 minutes long, and they include any information from how to choose insurance, how to file for your insurance, how to travel to and from your doctor's office for the first time. Lots of great tips so that you can see health literacy in action. And that's Catina's wonderful colleagues and staff have put together those videos.
We try really hard to make them light and fun and in plain language. We want them to be people focused. And so it's not about what the doctors need or what the providers need. It really is about what we've heard from community members about what would be helpful. So they're, we've heard, not painful to watch. They're sort of funny and liked.
Yeah. Would you like to introduce our one for today, Catina?
Sure.
Tell us what we're about to see.
So we're going to show you a short video about numeracy. So in diabetes care and management, numeracy is one of the primary issues that people have to think about because there are so many numbers that you're asked to think about, to track, to take care of, as well as you think about measuring medicines and all your daily activities just to make sure you're okay. Numeracy is a huge challenge, and it's hard for everybody. Most of us have not had advanced math since high school, if ever. So some of the fractions and decimals and large numbers that we're asked to deal with are complicated. So we put together this short, funny little video to help people think about numeracy and to create some strategies both on the patient and the provider side.
All right.
Let's talk about numeracy.
Yes, let's. I've heard Oprah's really into that lately.
We make health decisions every day, whether to eat healthy, get a flu shot, or go to the gym. And many of these decisions involve numbers. Think about it. We need numbers to calculate doses, read nutrition labels, and count calories.
Yeah, that is really important, but how are we supposed to get people to watch a video about numbers? We'd be like, 1, 2, 3, boring. Wait, I've got an idea. I know how we can spice this up. Let's add some cats. Everybody loves a video with cats.
One study of adult literacy found that 33% of Americans lack the skills to solve one-step math problems, and 22% don't have the ability to do simple addition.
See, look. 1 kitty, 2 kitties. Oh no. 5 kitties.
Fractions and other ratio concepts can be very difficult for people to grasp. This is true for individuals at all education levels and math ability. Even those that are highly educated can still perform poorly on numeracy tests. For many of us, numbers can present a real challenge when it comes to staying healthy. Here's some healthcare hacks for what to do when you're confronted with numbers you don't understand. 1. Ask your doctor to explain numbers verbally. In other words, what does 400,000 units mean? Can you show me? 2. Tell your doctor you need different measures so you can understand. For example, you could ask your doctor to show you in teaspoon versus milliliters. 3. Ask for a visual that shows you how to take your medicine. 4. Make sure you have a way to contact your doctor, nurse, or pharmacist for any questions once you leave the office or drugstore.
That is super. I love that because it's something that is so relatable to people living with diabetes, but also anybody who's taking any kind of medications. You know, sorry, y'all. We wanted more. Another video. There are more videos like that one if you are interested and you're like us and you just can't get enough because it's so real and it's so true and it's so relevant at Health Literacy Media Venmo, and you can see all of the different videos there. So as I was saying, there's, you know, I think there's a little bit of fear involved with feeling that if I say that I don't know, there's something wrong with that. And so I just want to, you know, re-emphasize if there's any way, anyone watching, you know, don't be afraid to ask. No question is too small, because we don't all know all of everything.
You know, this week who's actually a nurse that works in our hospital, and he doesn't work in an area where he's working directly with diabetes all of the time. And so that was one of the things that we established early on when I talked to him on Friday, is that you know, where was his starting point, and that it was okay that just because he was a nurse, that, you know, he wasn't expected to know diabetes at the level that I knew it, you know, and we came to that understanding early in the education, and then he just opened up and he felt comfortable. So it doesn't matter what your job is in life. You know, we shouldn't have expectations as people that we're obligated to know something, and we shouldn't feel embarrassed that we have to ask to have it explained.
Mm-hmm. So I think that we should speak a little bit to how many things it takes to manage diabetes that are related to this idea of health literacy. You know, is there a way that we can kind of explain to individuals that there's 1,000 decisions that you make in, you know, any day that will help you to manage your diabetes? There's 1,000 decisions and 1,000 ways to you know, make those decisions. Not anyone is necessarily wrong.
So I think one of the things that was brought out in the video is trying to understand in a better way what the volume is. Like, you know, when I'm teaching patients about their units that they need to take, and we have to keep going over that. And sometimes I can understand, or I get the feeling that they don't understand exactly what I'm meaning. And so we have to look at it and describe it in many different ways. But I think what was one of the things that was brought up in the little video about the amount, where it showed, you know, the 400,000 units, which was, you know, then showing that it wasn't a pill form. So, you know, sometimes being a patient too, you should speak up and say, well, I'm not quite clear on that. Can you show me or tell me in a different way? So that can be very, very helpful to ask that question.
Well, that's one of the things that we train providers on the other side is, you know, this idea that if someone seems like they don't understand, they look like they don't understand, they sound like they don't understand, it's not helpful to just say the same thing over louder. It doesn't help them understand to do it that way. And so thinking about how are all the ways we can bother to be prepared for those visits and think about what we need to know. And we really, even if we don't have the words to say, show me a different way, which now you do because we've talked about it, but just letting people know that you're confused gives them a chance to sort of think about how are the other ways they can say things, or what are the other references they have. So lots of times as patients, we want to be good. We have this idea that a good patient is polite, a good patient waits their turn, a good patient is quiet, a good patient does all of these things so that we don't cause problems. But in reality, when we're being what we think is a good patient, we're not letting the provider know that we don't understand. We're not letting them know that we're upset, that we're confused, and we really don't create that space for them to spend more time or to say more, or even bring someone else back in, right? I mean, they can bring in an educator, they can bring in a nurse. We know that doctors are not trained in the same way that diabetes educators and nursing staff and other people are to explain things. But when we don't tell them we need more and we don't even show that sort of vulnerability, they have no way of knowing. So all the things that we can do is just sort of let our confused face show, say, gosh, I really don't get that. I have no clue what that means. I think I get it, but it's not working. I still feel really sick. I mean, these are all the clues we give people.
Mm-hmm.
Yeah, I appreciated that patient that was a nurse telling me, well, I know that this is what I learned in a book, but I'm not really sure that I understand it. And I appreciated that he brought that forward and asked me to explain it again in another way.
Yeah,
I appreciated that he was open enough to tell me. So I appreciate when patients do that.
Mm-hmm. And building on what Marianne and Catina both said, we know that people learn in different ways. We know that some people learn best if they're writing things down, and some people learn best through listening, and maybe others learn best through, a demonstration or something that's really hands-on. And in a lot of cases, the healthcare system hasn't adapted to meet those different learning styles and really only focuses on sort of one learning style. And, as Catina said, I think in the health literacy world, we're trying to work with providers to get them to acknowledge those different learning styles and know how to explain things in different ways. And so just to come back to the point that it's okay. It's okay if you learn best in a way other than the way that your provider is presenting something to you. And it is completely within your rights to ask that it be explained in a way that you understand and the way that you learn best.
Yeah, we have one of our viewers was making mention that, for example, some people will look at a video before they'll read a handout. And so I think as a person living with diabetes, you want to communicate the way that you best learn to your clinician. I've had a lot of really great and wonderful patients come in and tell me, I don't really do that well with reading. I'm not going to read that. And so you have to find different ways of providing information to them. But as Catina was saying, I don't know that if you don't tell me. And I may ask you because I love that communication and I really want to know so that I can help you. But I've also been, trained to ask that, and maybe not every clinician has. But you might be doing a little bit of teaching as the person with diabetes, as the patient to that person too. You never know if you can teach your clinician a thing or two, because I always expect to learn something from my patients.
And the other piece of it is it's often more than one way. So we're talking about people learning in different ways, but for many of us, we need to see something and hear something and go back and see it again and maybe even explain it to somebody. So it's not even the idea that there's one format. It may be that you listen to the doctor or nurse describe it. They give you a handout that they've highlighted the important points, and then they point you to a link on the internet where you can watch a video or do something else. And if you put all of those pieces together, then maybe that's enough to what I think about is sort of lock it in, so that you can practice it over and over until you get good at it. And that's okay too.
Yeah, that's great. And one of my patients is now sort of an outreach. She does a lot of outreach here in Houston with Cities Changing Diabetes as a volunteer. And she was, when we first began, she didn't have a lot of the sort of skills that she needed to advocate for herself, but they were in there. We just had to unlock it for her. And once she unlocked it, when she went back, she found an endocrinologist because she just wanted to stay with her initial physician at first, but then realized, I think I need an endocrinologist. So she asked that doctor, and he said, I think you do too. They both wanted the same thing. And then she came back and she told me, I went to the endocrinologist and I told her how I was taking my medicine, and how many times and when I was going to take my blood glucose value. And she was shocked that I knew. And now she has this great relationship because she went in having practiced all these things. And now she's on a different path with her health than she was before.
And how powerful does she feel, right? Like she did all of that on her own, got it right, like educated the doctor, got what she needed. And that feeling of success is just hugely important for people. That's exciting.
Yeah, it's very.
Yeah, it's great to hear. I mean, we call it teach back, but after we've had conversation and we've educated our patients, to hear them tell it back to us and exactly what they're doing and how they're doing it. And then, as you said, they feel empowered because they know what they're doing and they can describe it back, and they feel like now they're educating. So it, again, it's back to that two-way street.
Mm-hmm. So is there anything, Catina and Susan, that you want to touch on that we haven't touched on yet?
I think we've been sort of dancing around the edges, but one of the things that I think is most important that I want to say just explicitly is, the reality is you're the expert in your own life. You know what's going on. You know what your health condition feels like, how you experience that. You know what you can and can't do in the context of the rest of your family life situation, your culture, what you feel like is appropriate. All of the pieces of what's real for you are what you know. And there's not anybody else that knows that more than each specific patient about themselves. And if you don't feel like you can share that, the risk is that, the providers are treating you sort of just like they treat everybody, like a textbook. And that's okay. That's a fine thing. But the way that you get the best care for yourself that you can consistently apply is that you really bring all of yourself and you talk about what you'll do and you're really honest about what makes sense for you. And you feel empowered to represent and reflect your own life because you really are as much an expert as anybody in the room. So, the doctor has all of this background in medical training. They know how to treat any symptoms that you bring up. They know how to respond, but they can't do that unless you bring the real issues forward. And so, I think that's really health literacy 101 is how do you show up and feel powerful enough to be the expert in your life and be a true partner in your healthcare.
Yeah. And to continue off of that, before I let Susan jump in here, to continue off of that, any of the different dimensions of care. Leslie, can you pull that up for us? Any of the different dimensions of self-care that are explained here. So support, nutrition, organization, weighing your risks and the benefits of specific care, medication taking, any of those things, any paperwork that you need. As clinicians, having the background in medicine and in treatments, we can adjust any of those things to you personally and individually. And so when you feel empowered enough to say something, to speak and to explain your culture or your discomfort with swallowing a pill or something like that, we can adjust and change directions and still accomplish really great care that is different and from someone else, but perfect for you.
Yeah, I think one of the things that I had happen is I had a patient who spoke English and Spanish, and she was fine to have me talk to her in English, but it was great that during our educational time, she brought up the fact that any literature that I would give her or any instructions she would get for taking medication, she would like to have those in Spanish because she could read that better. So I think that's just another example of speaking up and, sharing what you're going to need and how, just as you said, Joy, we can alter and as healthcare providers and provide that, but we don't know that unless the patient, brings that forward. So that's really important. I don't know, Serena, did you ever, encounter something like that through either your own or peer support?
Actually, yes. Actually, for both me and peer support, but I'll just talk about peer support. I had an in-person meeting one time, and I had a lady come in, and she was talking about her 3-month physical. And that's the one where you get the A1C, you get cholesterol check, you get all this stuff done, the whole workup. And her A1C went up from, I think it was like 7.6, it went up to like 9. And so her doctor, she told me her doctor asked her, well, what's been going on? Is anything different happen? Are you eating different, or what's going on? All she said was, well, I don't know what's going on. It just went up. But she told me that she knew that she had been eating, not as well as she should, eating more carbs, eating more desserts, drinking more soda and stuff like that. And I asked her, why didn't you tell the doctor that? Because she told me that the doctor immediately wanted to increase her medication. And she said, well, I'm just scared because I know the doctor's going to fuss at me because I didn't eat right. And I was like, but if you would have told the doctor that, maybe the doctor could have worked with you and try to give you some tips on how to, manage those cravings that you have and things like that. You never know what the doctor could have done for you. And now you're complaining to me because your doctor increased your medication, but you didn't properly communicate to the doctor what actually was going on because you were afraid to get,
Right.
that. So that's the big thing. People don't like to feel bad even when they do wrong. So, it's important to communicate everything and be honest. As Catina said, be honest about what you're doing when you're not at the doctor's office.
This goes back though, the reality of your own life of like, if you put all the pieces together, when you're eating poorly, when you're not doing all the things you're supposed to do, there's usually another reason for that too. So how do we uncover sort of what's the cause of the cause and, what's making you do that? For example, COVID-19, I've gained the 20, sitting at home with my young kids all the time, constantly sort of in a funk of uncertainty. It's really hot in St. Louis. I pass out if I get too hot, so I can't exercise outside. I don't have any exercise equipment. Like everything is wrong. And so I'm just sort of living in this world where things are wrong and I can't do much about it. So of course, if I have to go explain myself, when I have to go explain myself, I'm going to have to say all of this stuff happened, but it's not because I'm a bad person or it's not because I don't care. It's because, life is complicated and I don't need to be in a situation where I feel shamed about that. I need to feel a situation where, I feel comfortable enough that people can help me get on the right track, but that's not our usual experience. And so, getting back to those small steps, every day's a new day. And just trying to sort of find our sort of peace with the life that we are living in every moment, even when it's really hard, I think is important for people to understand, especially right now. I don't know anybody who is doing all the stuff that would get them the checklist right now of like being a good patient or a healthy person. Like everybody I know is feeling uncomfortable with the way that they're eating or sleeping or exercising, or even just their mental health. Like how do we balance ourselves when we're stuck at home all the time with people we love dearly most of the time, but make us crazy when we can't break out of the walls, right? We're gonna be bad. We're gonna be bad.
It's funny you said that because the young lady I just spoke about, she was depressed. And she was dealing with some stuff going on in her life. She lost her job. Her bills weren't getting paid. A lot of stuff was going on. So it kind of caused her to emotionally binge eat. And so that's the kind of stuff that people hesitant to talk to their physicians about, but they should. I believe that they should.
Yeah, you have to get it past it, but it's always there. We don't do bad things to hurt ourselves on purpose, right? Like none of us are seeking out to not follow the rules. If we're not following the rules, it's because we don't understand them, or because there's so much else going on that we emotionally, mentally, spiritually can't. It's not that we're all sort of self-defeating, dangerous people who want to hurt ourselves. If you talk to any of your patients, none of them say they want to be sick. None of them say they want to feel the way they feel at their worst. So when we're doing things that are self-defeating, there's always another reason. And so how to get to that and help people not feel guilty for the reality of really hard lives. I mean, some of the stuff that people are dealing with is really hard. And depression in and of itself, when you feel depressed and you're just waiting for somebody to tell you that you're a bad person and you have to say, oh gosh, I gained the weight, or I did this, or I did that. It just reinforces all the bad things you think about yourself. And so how do we help people feel confident in spite of their depression, in spite of their reality?
Yeah, I think that is a really good lead in to next week's session, because I think, now that we've told people living with diabetes, their support, patients, clients, our viewers, that you shouldn't be afraid to ask for help. We also need to share on the flip side next week that as clinicians, we shouldn't be afraid also to ask if someone needs help or to receive that question of help, because sometimes it's uncomfortable because you don't know how to be open enough to receive it. And then you may not know that you have resources to assist, right? So if you ask someone about their mental health, and then it's revealed to you that there is a concern and that they need help, do you have the resources? Do you have the network? Have you spread your net far enough to be able to answer that with a response, and with guidance to someone? So we are running over time just a tiny bit here. And I know we all are very, very passionate about this topic and very passionate about connecting people with their care all the way around. I think that health literacy is something that should be in every curriculum for, from high school to medical care to really anything. I think just the ability to self-advocate and to know what you know and know what you need to know is very important. And I thank you all for being here this morning.
My pleasure.
Thanks.
So thank you to our viewers. And on our MyDiabetesHQ Facebook and our MyDiabetesHQ YouTube, this has been another fantastic conversation with a very, very talented panels of speakers. Susan and Catina, I thank you both so much. I feel like, anybody who may have been confused before, I'm really excited that you both were here to guide us through this. And of course, my partners in crime, Marianne and Serena, as always, love having you with me. Mark your calendars, everyone. We will be broadcasting as usual every Saturday, 10 a.m. Central and 11 a.m. Eastern Time. Our next episode will air on August 1st, when we will bring an encore of this topic, Health Literacy in Action, Part 2, for physicians and clinicians. That's right, communicating with and not at your clinical members of your team are super important. It makes all your health literacy and self-care dreams come true. So we will have our Dr. Gadabeku here with us. She's a family physician in Philadelphia. And our conversation with her will outline the ways in which her clinic and care team have woven these types of health literacy skills into their practice. We can't wait to see you again, Dr. Gadabeku. Thank you, everyone, and I hope that you all feel that you're now part of the MyDiabetesHQ family. See you next time.